Well, Marianne, we know, of course, that good dental health starts with proper hygiene. And so this morning, I know you have graciously consented to giving us a demonstration on how one flosses correctly, something that we all assume that we're doing the right way, but very few of us actually are.
That's true, Valerie. Thank you for giving me this opportunity. And we're going to use Joanna here as our model, and she's been gracious enough to do that. So anyway, I'm going to start by taking a generous piece of floss here, and you're going to want to wrap it around your index finger several times so that it holds on its own. And then you're going to use your thumbs, excuse me, and your middle fingers, or a combination of the two, to actually control the floss. This is actually, the smaller your length here, the easier it is to control, and the less you'll cut into your gums or hurt them, okay? So if you'll open for me, Joanna, then what we'll do is I'm going to come in between the teeth and slightly wrap it around one of the teeth, Valerie. And then I'm going to just gently work it through that tight part. That's called the contact. And then I'm going to go down further, down below the gums, as low as the floss will let me go. And then I'm going to just swipe that up and down a few times, and then come around to the other tooth, and again, swipe it up and down underneath the gums. And that cleans underneath the gums, which is where the majority of plaque and bacteria like to hide and fester. And we just do that all the way around. And as you get good at this, you'll find that it doesn't really take much time. In the beginning, it may take a little time just because you're not that skilled at it yet, but if you just stick with it, you'll get quick and it won't be so difficult. Now, one thing that happens, I hear a lot from patients, is they'll find their gums bleed when they do this, and it kind of scares them. So I always try to educate them and say, bleeding is just telling you that you've been missing that spot and you need to clean that a little bit better. So don't be afraid of bleeding. It's just telling you, I need more attention in this area. And that's flossing.
I have one more question. I know sometimes if your teeth are really close together, it can be hard to get that floss in there.
Yes.
Are there wax-covered flosses that maybe make it easier?
Oh, thank you for asking that question. That's a great question. There's so many flosses on the market right now. We don't like anything too terribly slick, because the slicker the floss, the less it pulls out from in between your teeth.
That makes sense.
So the less effective it is, unless your flossing technique is really exceptional. But there are very few people who have exceptional technique. So you can go with some flosses that are like a satin floss, or a little bit more slick to use, that you can be effective with that. Also, you can tie a little knot in your floss, and that makes a little hook that will grab more things out of there. I think our favorite floss is a woven floss. It doesn't shred really easily. It really grabs plaque and any kind of...
Almost more like a very narrow little ribbon?
Yes. Yes, and there's always new flosses being developed, but something that is a little more grippiness, that will actually pull out any plaque or food debris or anything that might be stuck in between your teeth is what we like the best. Yeah, and just practice. I think practicing is the most important thing.
After every meal?
Well, actually,
or twice a day?
You know, we're happy with once a day. We try to be realistic. Once a day is fine. And then the rest, we hope that the brushing will pick up on. So once a day flossing is perfectly okay.
That's really helpful, Marianne. Thank you so much.
You're welcome, Valerie.
Thank you.